Hi guys, it's Tony the vet back again to talk today about cats and some of the reasons they might be vomiting or regurgitating their food. This is something that we commonly see in practice and it worries a lot of owners, so I thought we'd just quickly run through some of the reasons this might happen and some of the things you might need to do to address the vomiting and the regurgitation. So, as we've said before, cats are obligate carnivores, so all their foods are generally meat-based. Sometimes if a cat is changing food, they'll get a little bit of an upset tummy and that can cause them to regurgitate. There's a difference between regurgitation and vomiting. So if a cat brings up undigested food, it'll look a little bit like the food that it was eating. So you'll still be able to see some of the biscuits and things in the food. If that happens, it's important that you try and starve your cat, because if you keep feeding an upset tummy, the chances are the problem's going to persist and they're going to keep getting sick. So it's important to differentiate whether they've been sick with vomit or if they've regurgitated the food they've eaten. Oftentimes they'll regurgitate within 3 to 4 hours of eating. So if they bring up undigested food, the best thing to do is to stop feeding them and don't keep offering them food. This might sound a little bit harsh, but it's better just to give their tummy a break. So if you do have the opportunity maybe to starve them for 12 hours or so, or overnight if conditions allow, that would be the ideal. Because if you keep feeding an inflamed tummy, the chances are they might develop diarrhea. So in this instance as well, it's very important that you're careful, and if you're in any doubt, you take your cat to the vet. If you can, it's a good idea to just check to see that there isn't any other signs apart from the regurgitation or vomiting. If you do see other signs like pain or a stance where they look like they're posturing in pain, there's a good chance that there is something else going on. So it may not be that there's a simple case of regurgitation and something else could be happening. So you need to be very, very careful, and if in any doubt, take your cat to the vet. If you do see your cat getting diarrhea or any other signs of gut upset, it's important that you seek medical attention because your cat may need meds. If that does happen, the vet may or may not do certain tests just to see why the cat may be regurgitating or vomiting. Some of the tests may include taking sensitivity and culture samples so they can send to the lab and see if there's any nasty bacteria growing there. They could also do a little ultrasound of the abdomen just to check to see that the stomach and all the internal organs are okay. The other thing they could possibly do is if your cat does develop diarrhea, is take a sample of the feces and send that for analysis as well, just to see if there's any nasty bacteria growing there or if you have any parasites in the poo. All these things can be done safely in the vet practice, and the vets will be able to explain more to you what you need to do to look after your cat's gut health. So there's a couple of little things that you can use to help maintain your cat's gut health, and it's worthwhile doing just to make sure that if they do have any problems, you're ready and you're able to treat them yourself. So one of the things that would be good to do routinely is to give them a little wormer, which would reduce the chance of any intestinal parasites which may cause upset tummies. One other thing that you could have would be pre and probiotic, which would help with any gut upset. That may also help the flora in the gut and reduce the chances of them getting diarrhea, which would be a nice little thing to have on the shelf. If your cat does continue to get vomiting or regurgitation, it's obviously worthwhile going to your vet and seeking professional advice. There's lots of meds they can administer which would stop vomiting, prevent overreactions to acid and things like that. And there's also antibiotic and gut support that they could administer. So if you're in any doubt, I would strongly suggest you take your cat to the vet, just to err on the side of caution. So hopefully all of that makes a lot of sense to you and it helps you with your cat and your cat's gut health. And thank you for watching.